Yeah.
See what kind of attendance we get.
Yep.
Well, I mean, the whole thing, I'm going to live stream it on YouTube, and it's going to go, and then we'll have it, it's going to live on YouTube as well. So I think that's fine.
Okay. So no Jeffrey Toobin moments then. We can't do that because it's going to be there forever. Is it too soon? Is it too soon to make Jeffrey Toobin comments? I don't know.
Yeah.
It's too soon. Okay.
Too soon. Too
All
soon.
right. Good to know.
Let me put it this way. It's yeah, it's different. That's one of the things I really didn't think I would see on a Zoom meeting. Ew.
Be a little better. Less glare.
I know. I was in front of our windows. I was the black blob in front of the bright light.
Oh, speaking of
It's getting dark so early now. Earlier.
So Pascal, are you required to register for this to join it as just a viewer? Oh, maybe Pascal's gone. Hey, Ariel.
Okay.
Hi, Ariel.
Hi. Hi, Shelley. Hi, Phoebe.
Hi.
Hi, Dr. Trichet.
Hello, how are
Hey.
you?
Hi, Glenn.
And by the way,
Hello.
I'm just saying, we are live.
Okay.
We are live on
Thanks.
on YouTube right now. So.
Hi, John.
The final version will not include our pre-meeting banter. So that's going to be, I will take the version, we start at 6 p.m. and that will be the final version that will be on YouTube.
Great. Hey, Dr. Johnson, thanks for joining us tonight.
I almost said good morning. That kind of
That's a bad sign.
I probably wouldn't have noticed or disagreed. Yeah.
Hi, Steve. feel like we should have background music or something.
I know, huh?
I won't sing though.
But what would be the theme of the year?
Yeah, yikes.
It's circus music. That's our soundtrack.
I like it.
If you hear a dog barking, it's my constant companion here.
Aw.
Oh,
Just had a bath, so she needs a little comfort. She does not like baths.
what's her name?
Her name is Nisa, like Lisa. It's a Norwegian word that means happy little girl.
Oh,
Describes her perfectly.
oh.
A happy dog is a dirty dog, of course.
Okay, so we're 1 minute out.
Pascal, will we be able to screen share it all, or is that something you want us to be able to do?
You absolutely. That's one of the advantages of the webinar. You can absolutely screen share if you want.
Okay.
And it's 6 p.m. Let's get this show on the road. Good evening, everybody, and welcome to this town hall that's entitled Overdoses in Nevada County. Not necessarily a topic that anybody looks forward to, but in 2019, Nevada County had zero fentanyl overdoses or fatal overdoses. As of today, we are up to 11 fatal overdoses in Nevada County for 2020. And I would like for everybody to understand that we're going to talk about this topic. It is sensitive. And so maybe if you're watching this with smaller children, just maybe be aware that we're going to talk about really difficult stuff. So it's up to you to use your judgment. And the goal of this is to create a dialogue with the community, because there has been a lot of talk, chatter, rumors, and misinformation also in the community about what is happening and what is done or not being done. So if we could we maybe Dr. Johnson, could you maybe kick us off, and then followed by Dr. Evans, and talk about the situation here in Nevada County. What is happening? Where are we at?
Yes, thank you. My name is Rick Johnson. I'm the interim health officer in Nevada County, and I thank you for the opportunity to being able to chat with you tonight. A few weeks ago, the Nevada County Sheriff's Office posted on social media that they'd received numerous reports of opioid overdoses, and they pointed out that several of them were linked to fentanyl. They had said that in their investigation, they learned that many of the fentanyl overdoses were the result of people ingesting counterfeit prescription drugs that were laced with fentanyl. Now, I'm not going to read the post. John is on the call, so he quote the post if he decides to do so. But basically, this posting and other concerns that were raised directly to public health by community members prompted us to review what we have available to us in the health department, and that is death certificate data, to determine how many accidental drug-related overdose deaths there were so far this year, and to see how many of those were due to fentanyl. And then we turned around and looked at the year 2019 for comparison, and here's what we found out. In 2019, in the 12 months, there were 18 accidental drug-related overdose deaths in Nevada County residents, 0 of which were attributed to fentanyl in 2019. In 2020, by comparison, so far, there have been 24, not 18, but now 24 in this partial year, accidental drug-related overdose deaths, with 11 of those due to fentanyl. And you might say, well, these are probably all in young people, right? No, they're as young as 18 some in their 20s, 30s, 40s, 50s, and 60s. So all ages essentially represented. 3 of them were in the Eastern County, and the others were in the Western County. We also looked at data from the EMS system through our local emergency medical services agency and found that the use of naloxone, which is the antidote to fentanyl and opioids, dramatically increased in this last year. There was a spike in overdoses resulting in a spike in the use of naloxone, both by bystanders, by law enforcement, and by EMS personnel. So that is significant, and that correlates with the history of deaths. So all of this data put together seems to verify what the sheriff's office had warned the community of. So the health department recognized that this needed a community-wide response. And so we reached out to behavioral health to coordinate a meeting of key community partners to share the data and discuss how we individually and collectively could work together to address this community crisis. I mean, right now, the crisis we always are talking about is COVID, but in the midst of the COVID crisis, here we have a crisis with opioid deaths related to fentanyl. So from a public health perspective, our response role is this. One is to ensure that there's accurate data so that we can truly understand what's going on in our community and keep monitoring that. And we will continue to do that. The second thing is we want to make sure that there are multiple avenues for the public and the professional community to have available naloxone or Narcan so that we can go ahead and try to prevent these deaths. And that should be in the hands of not only the professionals, but also family and friends of those who use opioids and community members who might come in contact with people at risk for overdosage. Public health is involved in community outreach and community education about factors that increase the risk in our community, such as this one, which is talking about fentanyl in the local drug supply, and talk about approaches to reduce that risk. And then we need to partner with public safety on data sharing, on surveillance, targeting the interventions that are required, and naloxone support. So since 2017, public health has been distributing naloxone and has assisted numerous other agencies and organizations such as behavioral health, local law enforcement, first responders, public defender, hospitality house, North San Juan Community Center, and others in navigating the path necessary to either access Narcan or to become distributors of Narcan to members of the public, including the very brief education that's required to go ahead and administer naloxone. We've released a PSA on October 16th. We've created web pages on fentanyl and naloxone access, and we will continue to update our data and share that with everyone else so that we all can have a shared picture and understanding of what this continued risk is to our community. So thanks for the opportunity. Appreciate it.
Thank you. And Dr. Evans, and then Elenia Stevens, could we hear from you as well after Brian gives us his perspective?
Thank you, Pascal, and thank you, Ubinet. I appreciate the opportunity to talk about this very important issue and for you to put this on. I think it's really a good idea to be talking about this. As Dr. Johnson said, we've been in COVID mode for the last 10 months basically. And I think it's been easy for everybody to just get hyper focused on the one issue of COVID and to not focus on some of these other very important public health issues. So I really appreciate that we're doing this as a community. I think that the Department of Public Health and the other partners that we have in Nevada County have really done a phenomenal job of addressing what's going on in our community. I just have a couple of comments. So first of all, for those of you who don't know who I am, my name is Brian Evans. I'm the CEO at Sierra Nevada Memorial Hospital. My background is in emergency medicine, so I'm an ER doctor, and the bulk of my career has been spent clinically taking care of patients in the emergency department, mostly at Sierra Nevada. And so I know very well what it's like taking care of patients who have overdosed on opiates. Certainly we're able to rescue some of them, and other people unfortunately don't make it. And this is a very serious issue, and it's not new. This issue with fentanyl is relatively new. And I think we need to really talk about that issue and focus on that issue. But I also want to just point out that even if we can sort of get our arms around the fentanyl piece of this and the counterfeit drug issue and fentanyl, the opiate issue as a whole is still extraordinarily significant. And we have to, as a community, really deal with it. And it's a nationwide issue. It's an international issue, actually. And there's so many things that have contributed to it that are really unfortunate. One is the overprescribing of narcotic medication by physicians. Another is big pharmaceutical companies really pushing opiates out to the public. And then I think another thing we have to be very honest about is the stigma that has been associated with patients who have had substance use disorders in our community and everywhere, really. And I would say I'm at least happy to say that when I trained back in the mid and late 90s, we're farther along now with regards to how we deal with people who are struggling with opiate addictions. Back in the 90s, it was really a lot more blaming of patients and, for their own addiction issues. And I feel like, especially on this panel of experts, there is a tremendous understanding that it is a disease process that we need to work with and solve together as a community. And stigma has no place in the treatment of this disorder. So I just want to get that out there. I think that COVID has been an extraordinary event in our lives, and it has exacerbated this problem. It's not just the fentanyl that's in these counterfeit pills. It's also the fact that people are under enormous stress. Financial stress, social stress, their support systems have been distanced from them. They're uncertain about our future. And because of that, I believe it has led some folks to addictions that maybe they wouldn't have struggled with as much. So it's good that we're getting together to talk about how to solve this problem. Again, I think the public health department has done a fantastic job. Dr. Johnson's done a great job. And I want to be part of that solution as the CEO of the hospital. I think the hospital has a big role in this as well. So I'll just leave it there for now, and I'll answer questions as we go.
Thank you. And Delinia, welcome.
Thank you. So I'm Alinea Stevens, and I'm the medical director at Chapaday Indian Health Clinic. So we have a clinic in Grass Valley. I'm also a family medicine doctor and an addiction board certified physician as well. And so I do some treatment and MAT groups at Grass Valley. And I want to kind of echo some of the things that I've been seeing this year compared to the past. I think nationally, when I was at the recent addiction conference, they said 20% increase this year in overdose nationally. And I'm seeing a lot more instability in my patients who suffer from addiction this year. There's longer wait times to get into residential when they are unstable, just because of the nature of this pandemic and making sure that we're socially distancing and things like that. There's more stresses in their lives. We're seeing more patients who are pregnant who are using drugs as well at a higher rate than was last year. And then just more mental health co-occurring disorders that are happening too. So I think it's complex and we'll probably need like a multi-pronged approach to really treat this. I think this is a symptom of a greater problem. But I do think that the first step is public awareness. Some of our patients are seeing fentanyl in their methamphetamine supply, in their marijuana supply, and in Percocet, which is what Dr. Johnson was talking about. So having fentanyl strips available for the public. We do a lot of testing for fentanyl in our patients to kind of just give them awareness of what they're using as well. So I'm happy to be here, and I think we're excited to hear the conversation and kind of brainstorm some solutions around that.
Thank you. And of course, a lot of times the uh, users, or especially when there's an overdose, so somebody will call 911, dispatch will of course send medics, and more often than not also law enforcement. So maybe that's a good segue to switch to the law enforcement partners that we have here tonight. We have Steve Johnson from Grass Valley PD and John from Nevada County Sheriff's Office. And maybe can you kick us off, John, and tell us a little bit about what the experience for Nevada County Sheriff's Office is, and what is your involvement when a call like this comes in?
Good evening. I've been with the Sheriff's Office since 2007, and a large part of my job detail has been in narcotic enforcement. And this year, more than any that I can remember, fentanyl in particular is a huge scare for us. Narcan's being distributed. I think GVPD, as Captain Johnson can talk to later, has carried Narcan for I think a few years. But its use in general from EMS, fire, LEs, or bystanders has gone through the roof. We're seeing people switch from maybe heroin or another opiate to something that's more available, which it's supply and demand right now. We could speak to the COVID-19 playing a role in that down the line, but long story short is we shut down our borders, and it's harder for a lot of the drug cartels to get their illicit narcotics across the street. Therefore, they search for other answers to keep making revenue. And where counterfeit pills have been a problem for quite a while, it's just more prevalent right now. And the ease for the cartels to get their hands on fentanyl, it's coming from, through our research, coming from China to Mexican cartels. That's where they're producing these pills and then sending them up our way. So we're seeing huge increase. That's a lot of our caseload right now with our special investigations unit, is trying to identify the suppliers and even the users when we come across them, to get their story more now than ever, why they're using, how much they're using, why they've switched from, let's say, a heroin to a synthetic opiate. So we're deep in it, but still scratching the surface.
If I unmute myself, it's easier. And Steve, what about GVPD?
Yeah, thank you. I think it might be a little interesting. I've been with the Grass Valley Police Department since 1995. And just by way of, for the community, a little bit of history. During that time, I remember in the mid to late 90s, heroin was around, but it was declining. And, by the early 2000s, it was all but gone. We didn't see it in Nevada County anymore. And it had been replaced by other drugs like methamphetamine. And it was really kind of off the scene there for almost, I don't know, for many years. And John can echo this. And then I think with the proliferation of the synthetic opiates that began to come out, the oxycodones, the oxycontins, and that kind of stuff that, as Dr. Evans mentioned, and initially were being prescribed and handed out in abundance. And people were getting hooked on those synthetics. And when the prescriptions either ran out or, they couldn't get them anymore, they weren't available, what we saw is people started turning once again to, the street version of the synthetics, and that was the heroin. And so we saw heroin come back. And, it's been back in our community for many years now. But it was kind of interesting in law enforcement to kind of watch it, disappear off the map and then come back. And just tragic as we see it just affect people's lives. And then, of course, in recent times, what we've seen is that the introduction of fentanyl, and whether it's as a substitute for heroin or you know, a legitimate opiate, or it's something that's laced in there, and it's not just with the heroin anymore, but we're seeing it, you know, introduced into methamphetamine and marijuana and other things, and sometimes with tragic results. And I guess as we began issuing our officers naloxone back at the very end of 2016, so we've really had, you know, about 4 years now that our officers have been carrying that. We've seen that about 3 to 4 times a year, our officers have used it to bring someone back, you know, from an unconscious, unresponsive state, which we would typically consider, you know, an overdose on an opiate. And the interesting thing about what we've seen is that, and John can attest to this too, I think, is fentanyl oftentimes arrives in batches, if you would, or, you know, we'll get a batch of it in the community. And so we'll see that the need for naloxone and these type of overdoses will come in waves. And while that bad batch or that laced batch of either counterfeit pills or other drugs that are laced with fentanyl kind of works its way through. And so, you know, like I said, over the past 4 years, we've used naloxone approximately 3 to 4 times a year. And one of the concerning things is that this year we actually started out pretty well. This is just Grass Valley PD. But the first time we had to use naloxone for an overdose situation out in the field was August 6th. But in the month of August, we had 4 incidents where we had to bring someone back from the brink of death with naloxone. And so we saw that it kind of all converges on this bad run of fentanyl-laced drugs that hit the community. And we get this wave of use of naloxone. It's a wonderful tool. And, you know, the officers will tell you just the fact that they have something that they can use in the field and feel like they can actually, you know, have something that will help and bring someone back until medical help arrives is a wonderful thing to have. But August was a bad month for us. And, you know, you look at what's going on in the community and COVID and all the social unrest and then the fires and all the stress that everyone has talked about already that's been put on society, and people are isolated, they feel lonely. They're desperate, whether it's financially or with their kids, with family situations, and they're fearful, they're frustrated for a variety of reasons. And so, you know, it stands to reason that that's caused a lot of people to search for coping mechanisms. And unfortunately, you know, when substances are what they turn to, oftentimes, you know, it's disastrous if they run into a batch of something that has been laced with fentanyl.
This is Dr. Johnson again, just to reinforce what Steve just said on the Sacramento Valley EMS reports, which is countywide, not just Grass Valley. In May, they reported 6 uses of naloxone. In June, 9. In July, 4. But in August, it went up to 15. 15 in the month of August alone, and that's obviously countywide, but that was the peak. And after that, it dropped down to very low levels again. So like you say, it does come in batches, it does come in spurts. And August, as Steve said, seems to be the peak according to the EMS reports.
Do we have data for September already?
The EMS data for September that I have shows 4 usages in September.
And Ariel, can you talk a little bit from your perspective, people that are reaching out, that want help, that come to you or another facility, and maybe for those who don't know who you are, just introduce yourself and Granite Wellness, that most of us still call CORE.
Yeah, so thanks, Pascal. My name is Ariel Lovett, and I'm CEO with Granite Wellness Centers, formerly Community Recovery Resources, known as CORE. We go back actually in Nevada County since the 70s with various names, but we now are the primary nonprofit provider of substance use disorder treatment for Nevada and Placer County. So we actually, our services, like the region, span from Roseville up to the Tahoe Truckee region. And similar to what all the other panelists have been saying, we also began, I actually had to, call Phoebe that morning that Phoebe had emailed me saying, hey, we're really concerned about this. Although, like Dr. Evans said, we've been in an opiate epidemic for some time. And we, along with other partners like Chappaday, the hospital, Western Sierra, who's not on this call, but a lot of local providers ramping up our medication-assisted treatment, which I'll talk a little bit more about. But we're already in this response to the opiate epidemic, then layering the COVID epidemic, but then starting to recognize this really alarming spike in fentanyl use and overdose. And, so I think that I want to keep it fairly focused. And I think our other panelists have said a lot of the things that need to be said. I actually had listening sessions with all of the residents that are currently in our residential treatment program to really learn and really be able to target the outreach that we're providing. So I think there are three messages that I really want to communicate. And one is that fentanyl is dangerous. And that seems obvious. We all here, we know that. Many people that are using it don't know how dangerous, and especially we're very concerned about our young people. Fentanyl being 50 to 100 times more potent than morphine. And so getting that message out there very broadly and clearly in the community. The second one is that it is showing up everywhere, anywhere. The sheriff's department did a great job with the outreach about the pressed pills, the Percocet, that are laced with fentanyl, but also in cocaine and in heroin and in MDMA, as well as being used on its own. But so, and this was true with folks currently engaged in treatment, not knowing that it was in fact present in these other substances that they're maybe using intentionally and knowing how to manage their use, but not knowing the presence of this deadly synthetic. So the messaging being it's dangerous, and it is more places than people know. And that's where it's really helpful for, with our law enforcement really working on that, the supply chain, where is this coming from? Because it is coming into our communities and people, using substances and not knowing that it's present. And then the third one is really probably Pascal's main question answering is that help and resources are available, and we still are really working to get that message out there. And those are multiple, and really getting the message out there that, we being not just Granite Wellness Centers, but, all these partners on this call, behavioral health, public health, Chappaday, Western Sierra, the hospital, I think really are committed to meeting people where they are. And that might mean starting with the distribution of Narcan kits. And I'd love to do some screen share in a second of some upcoming resources that we have, but Nevada County's done a great job creating a Narcan or Naloxone, Narcan being the brand name for a Naloxone distribution effort. We have an outreach coming up at the end of this month where we'll be giving away free kits with the brief training and education that, treatment is available, both outpatient treatment, residential treatment. There were, as I think Dr. Stevens alluded to, we have had, due to COVID and due to demand, sometimes there are waits and sometimes there aren't. Letting people know that medication-assisted treatment, I think there's still not quite full awareness that medication-assisted treatment is widely available in our community and very effective. And that's been a push, federal, state, local, public health, governmental agencies have been pushing as well as we have. And the hospital has been an awesome partner in stepping up in their bridge program. I don't know if Shelley's going to talk a little bit about that, but we really want people to know that these services and resources and supports are available in a non-judgmental way. We also have, and Phoebe might speak to this, but also, with the distribution of Naloxone, also promoting access to fentanyl test strips. So for people that are using illicit substances, can test for the presence of fentanyl and be able to prevent the deadly overdoses that way. So those are the three real messages. And even, you know, in these listening sessions, people saying, hey, I didn't know until I heard from a friend that I could get into treatment. I didn't know that behavioral health would help me. I thought I had to do something bad to get into Granite Wellness, you know. So really all of us taking responsibility in every opportunity we have. So I don't know if I can share screen right now, Pascal, or we're waiting for that.
Please.
Or a couple of,
Yeah,
okay.
please go ahead.
And hopefully that will work. So this is, we've been distributing this flyer as part of the awareness. This is obviously in Spanish. So also wanting to reach out to our Spanish speaking communities throughout Nevada and Placer counties. We have one with Behavioral Health's Correct line on it. So I'll send that in a minute, but Nevada County's crisis line, our medication assisted treatment program. And we, you know, we'll support people to access other programs too, that we refer to Chappaday, to Western Sierra, to Stalent, to, you know, various other providers that can be the best supports. I wanted to highlight this upcoming event as well. And I will, when it's not my turn, I'll drop some links in the chat for folks as well. But our Recovery and Wellness series coming up on October 29th, this will be a Zoom training where we'll be able to provide free Naloxone or Narcan kits to all attendees. So it'll be an orientation to what is medication-assisted treatment, how to use Naloxone in reversing overdose, and also just information about opiate use disorder. So that will be on Zoom at this link, and then people can drive through and pick up the kit at any of our sites throughout Grass Valley, Lincoln, Auburn, Roseville, Kings Beach, and Truckee. And then also sharing, you know, basic information like this out into the community. I think that Steve, a couple people, and Dr. Evans both mentioned the imperative to address stigma as a barrier to treatment. Making sure that people feel comfortable. And I think that's what, you know, anyone on this call can do, you know, that all of us need to do on a daily basis is be that person that someone can talk to and have some resources to go to. One other that people could jot down is choosemat.org. And that is California's site that will allow people to put in their zip code. So if, you know, anywhere, and link to medication assisted treatment and related resources. So, so those are some examples of some of the resources that we're sharing to get this information out into the communities.
Perfect. Thank you, Ariel. And Shelley, you are also with Sierra Nevada Memorial, and I believe you have some interesting experiences to share with you. Please go ahead.
Yeah, hi, my name is Shelley Leal, and I am the substance use navigator at Sierra Nevada Hospital. We've had the Bridge program for about a year and a half now, and it's really interesting to watch it grow, because when it started, you know, people were pretty hesitant to come in and seek out treatment because of the stigma. You know, people are embarrassed, and it's hard to come in and say, I need help. And over the year and a half, watching people, I mean, our program has really taken off, and more people are coming in. They know they can walk in the doors of our emergency room and say, I'm here for Suboxone. And our staff is wonderful. They've been received very well. And so what happens when they come in, someone will call me and I'll meet them right there at the bedside. And if it's appropriate, if the doctor finds it appropriate, they will induct them right there with Suboxone. And we have about, I think, 10 providers now with X waivers, which is special licensing that the doctor needs to prescribe Suboxone prescriptions. So we always have a doctor on staff that can send that patient with a prescription. And then I can link that patient up to a clinic, whether it's Granite Wellness, Western Sierra. So it's a pretty smooth process, and it's a great community effort, all of us working together. It's been very successful. I'm very proud of what we're doing at the hospital. Yeah.
And can you give us an estimate of about how many people do you see in a month? And and obviously you also have seen this increase in patients. So, but
Mhm.
are we talking 2-3 people? Are we talking 10 people in a month?
Well, it varies. Sometimes it can be, I think my lowest month was like 4 people. But in the summer, my highest was 18. And so that's a lot for 1 month. So it does vary. But I think our program is getting out in the community a little more, so people know we're available, that they can come there and get assistance.
Great, thank you. We also have Grenat Rocher and Jill Blake, both with Nevada County Public Health. And so if, would you like to add anything to the introductions, or should we get to the questions? Jill, Glenna?
I'm fine with getting to the questions. I think Dr. Johnson pretty much said everything that I would have said.
Okay.
I agree. Questions are good, but may I ask one question real quick, because I did get dropped for just a moment. I'm not sure, Dr. Johnson, if you had a chance to talk about the fact that Placer County and is it Sacramento County are also seeing increases?
Did not, go ahead.
I think that was it. Just that you had shared when you came together with regional health officers and asked if other neighboring counties were seeing the kinds of increases in fentanyl overdoses that led to accidental deaths. I believe it was Placer and Sacramento County. Is that correct, Drs. Roche and Johnson?
At least
They too were
Sacramento,
seeing?
I don't recall Placer, but at least Sacramento is reporting a similar experience to what's happening in Nevada County. And that's not surprising, and it probably depends upon what the distribution channels are for the different drugs, where they're coming from and where they're going and who the suppliers are. Sacramento did, and I don't have any data, it was just an anecdotal report, but it was from their health officers also in Sacramento County.
Yeah.
So I received several questions from people who had a very different approach to this problem, because they wrote that they were either the spouses or the caregivers for people who had opiate prescriptions, and then the opiate prescriptions were cut in half, or in some cases just not renewed. But the patients were still in incredible pain, and some said that basically out of desperation, wanting to help the patient, people would go out and, like one of them put it, I had to learn how to score opiates. So this question goes to our healthcare providers. Is it, in your opinion, is it better to have people go off opiates, of course, after a while, or is it this due to the system that you have to say at some point, well, you know what, you can't have you can't have whatever pain medicine you have to get off that now? Are those purely medical, or are they systemic issues? And so a patient or a caregiver in that case, what tools would you give them? Because they're very desperate for their patients or their spouses, and of course they are also, on the other hand, they're deadly afraid as well that they would get a quote unquote bad batch and do incredible harm. So who wants to take this one first?
Well, I would just say that from an ER doctor's point of view, and in the past, we did not have the same tools that we now have today. Thank goodness there's been some advancements in the way that we can deal with the symptoms associated with opiate withdrawal. I'm not an expert in treatment with Suboxone. I think that there's a lot more expertise over at Granite and at Sierra Family and other places. But this is the problem with opiates, is that they're extremely difficult to get off of without help, And that's why what we need to do is connect people to the help that we have. And part of that is the medication treatment that we have. And the other part of it is the psychological support that could be offered and so many other things. So I would just say, people need to seek help, and there is help, and the symptoms can be managed. And so can all the other stress associated with getting off of these difficult substances. So is it going to be a cakewalk? Probably not, but I think that it can be managed.
Thank you. And Dr. Stevens?
Yeah, as a family medicine physician, I have these conversations a lot with my patients. We taper people. What I've noticed is sometimes switching them to buprenorphine for pain, even if it's more dependency instead of addiction, can be helpful. But what I also notice is people who are on chronic opiates, kind of what Dr. Evans was alluding to, they have this dysphoria and like depression and anxiety from this roller coaster of opiate withdrawal that kind of is very disruptive to their lives. And when they do get off of it, it does get better, and their mood is better, and they're able to be more clear. And so there's different tools that we have to do that. And there's help now at Chappaday, at Western Sierra, Granite Wellness, Family Sierra. Like there's a lot of MAT programs that when I started 4 years ago wasn't in existence. So we have the tools, and we understand a little bit more about the physiology of it. So I'm hoping that helps. But there is still a stigma, and so I think compassionate and understanding our role as physicians, and maybe part of the problem that started in the 90s, and being empathetic to that patient experience is important.
And I'd like to add something too. I think at some point, physicians started changing the way they treated chronic pain, but there were a lot of people who were stable taking narcotics. And at this point, if someone has been cut off completely without any of the long-term tapering or the help that they should have, I would encourage that family member to find another physician that might be able to help them. Dr. Stevens has just mentioned that at Chappaday, they have a good treatment. And rather than going on the street and finding illegal drugs for their loved ones, change doctors. If the doctor that they're seeing is not meeting their needs, there are plenty of doctors that can. It doesn't mean that they'll get narcotics forever, but there are other ways now of treating pain, and you can be tapered. It takes a long time, but you can be tapered from these drugs.
Yeah, I have to say I was really shocked by the messages, by the emails and calls that we got in ahead of this town hall. The number of people that found themselves in that situation and that were really they are, and some of them actually did what you said, Dr. Trosche, and they went and tried to find other doctors, but oftentimes with the insurance or that type of insurance, it was very difficult. But moving on from that, so we've all heard or seen the rumors that that there is a lot of juveniles that are now all of a sudden addicted to these opiates, and people are like, well, of course it's COVID, the isolation, the drastic changes in behavior that everybody had to apply and still does. So can we talk a little bit about how COVID can, on the other hand, wouldn't COVID and more isolation, wouldn't that make it easier for people to stay away from maybe inducements, or stay away from a group of individuals that they normally would hang out with, and why is COVID all of a sudden being a factor in this increase in fentanyl overdoses? Or is it a factor?
I don't know if I can fully answer your question, but I can start. A lot of our outreach really has been focused on young people. Again, even prior to this fentanyl spike, California was very concerned about young people. Well, even again, preceding this, we know that 90% of Americans with a substance use disorder begin their use as children and teens, and that is how the neurobiology of addiction progresses. And so from a public health approach, from a treatment provider approach, we want to, for multiple reasons, start outreach and prevention with our youth. I think that for our young people, I'm also the parent of a couple local teens right now and going through this. And what we know is that what we are experiencing, that Dr. Evans, I think, outlined really clearly, the stress, the anxiety from multiple aspects, not just the isolation, but fear of the disease, fear of the unknown, economic pressure. Our young people are experiencing that just as much. They are also not isolating as much, and this is happening, we know this is high school students and college students, and again, I think there's a lot of factors there that in the developmental phase of the teenage brain that is also really susceptible to developing addictions as it's in that crucial developmental phase. It's also a time when we young humans need to connect with people. So I think it's a really challenging confluence of factors that is exacerbating potentially this already really risky situation. I think our outreach to young people needs to be, like to all people, very honest and very resource rich. So they need to know that we're supporting them, that we'll listen to them and provide them honest, factual information. I think that needs to be also the focus of our outreach and tied into what they care about, which is find out what they care about. But their whole health is part of that. Connecting with their peers is part of that. And I think I just wanted to respond. And when it came to teens, another real concern is the presence of fentanyl and Xanax, and Xanax bars that are accessed on the street illicitly, and really concerned about that and our young people. And it seems like a lot of our young people are really heads up, but I think, again, a lot don't know. So coming back to those same messages, that they need to hear this. I mean, we can't protect them from the fact that this is happening. And so they need to know the risks that are present in their community, and they likely already do.
So Pascal, also working as a school resource officer for a little while with the sheriff's office, and then also I've coached for a dozen plus years youth sports. Having kids at school is important. There's some families that we don't all see that the child, his one breakaway for the day is going to school, whether he says he likes to be there or not. That's his breakaway. For the longest time, back in the 90s, we talked about after school programs and what it does to save kids. Well, now we're keeping children at home. Idle hands are the devil's workshop. Take that how you want it. But a firm believer of, we don't have any structure for these kids going forward, and mom and dad are trying to make a living at home. Next thing you see, junior's reaching out to people he normally hasn't. And also the avenues for kids to talk to each other nowadays is all over. I can't even keep up with my 17-year-old son's messaging. There's 100 different apps on how they can talk to one another. So it's very scary. I think a lot of good parents are trying to make ends meet, and a lot of children are paying the price for being home, being forced to be home.
I just want one quick thing on that too. 2 of our local pediatricians became ex-waivered as well. So meaning that they, with Sierra Care physicians, Dr. Mike Curtis being one of them. So making sure that their healthcare providers know that if there are young people with opiate use disorders, Alexa Curtis here at Granite Wellness, nurse practitioner, and then Dr. Mike Curtis as well, can both be good resources for that. And I'll put a number in the chat as well.
And then at Chapaday, we have Dr. Keon and Sarah Bland and myself up there that see kids as well.
Awesome. I think just to piggyback on some of what's being said, I think we still don't really know what the long-term impacts of this COVID chapter are on sort of the mental health and behavioral health needs of our community. We had a lot of theories going into this about what we would see and a lot of fears, and some of that is certainly playing out. I think we all know that everybody is struggling a little bit. There's a lot more depression and anxiety in certain ways. But on the flip side, I've also been really impressed by the resilience we are collectively showing our young people, our older people. We haven't seen the skyrocketing rates of suicide that we were worried we would see, or the skyrocketing rates of needs to come into our crisis systems. So how much of what's happening right now around overdoses has to do with COVID, I think is a little bit hard to say. And I think kind of it doesn't matter in certain ways also. It's an indicator of a need in our community. And I think all these different partners are putting a lot of different ways we're trying to address that need and meet that need. And I think, like Ariel was saying earlier, meeting people really where they're at, wherever they are in their continuum of use, of desire for treatment, and starting dialogue, opening the door to say, hey, this is a tough one, and there are a lot of options here for you when you're ready to engage with them. And in the meantime, here's some ways you can keep yourself safe so that you have a chance tomorrow to think about getting into treatment if that's what you want to do. And that's even more true with our young people, helping them see the options that lie before them so that they stay safe in whatever path they're on right at this moment in time. And I think I just want to touch for a sec on the fact that it's easy to begin to think about this situation that's going on in the abstract, and their numbers that we're sharing and sort of data points that we're putting out there and phone numbers and access and all those pieces. But at the end of the day, these are people in our community that are being really painfully impacted by this. People's lives are being lost, people's lives are being changed. And every one of these data points has circles of suffering around them, people that loved them and cared for them, their friends, their family. And we need to use our own social networks to think about how do we get more word out there and as Dr. Evans said, decrease that stigma and really open, honest dialogue on this topic so that we can really together reach out for the help we all need when we need it.
And speaking of reaching out for help, maybe we should touch on the Good Samaritan law. So basically, if you are in the presence of somebody, and if you are even if you did drugs yourself, and you are calling 911 because somebody has an overdose, please don't just run away. Call 911 because, as I understand it, you will not be prosecuted for doing drugs when you call 911 especially for an overdose. Could maybe John, can you weigh in there, or Steve, one of you?
I think that's a great idea. You're correct. It's accurate. Maybe that's something that we need to push out as a community to let everybody know that's unaware. It's very common for us to have people that want to help but are afraid oftentimes to call law enforcement due to the fear of getting arrested themselves. So that might be another public service announcement that's worth pushing out.
Steve, anything to add?
No, but just that is a very important message, and that is absolutely correct. I mean, in the city, we have cars that'll drive up to the ER at times and roll someone out the door and speed off because they're afraid that, they're taking someone to get help, but they're afraid that they're going to, be arrested for doing that. And there are amnesty laws, Good Samaritan laws in place that protect individuals for that, valuing the individual's life above all else. And so whether it's you're calling from a home and law enforcement, first responders are coming to where you are to render aid, or whether you're taking them into a facility, that's not something that people need to worry about. Obviously, the priority is saving someone's life.
And maybe, yeah, go ahead. No, go ahead.
regarding naloxone, there might be some hesitation on some people's part to say, well, what if I don't really know if it's drug overdose? What if I make a mistake? There really is no downside to giving naloxone. If it turns out it's not a drug overdose, the patient or the person that you're giving the naloxone to will not respond. And so if the person doesn't respond, you can give the dose again after a couple of minutes. But if they don't respond, then think through what else you need to be doing in terms of CPR and certainly calling 911 and so on. But it's not like the patient is going to have a bad effect from giving naloxone where it wasn't necessary. There's no downside to it. Give it if there's any doubt. The thing is, it needs to be out there. It needs to be available. It needs to be given liberally when there's any doubt, when there's an unwitnessed person down where you don't know what's going on. Give the naloxone. And if they don't respond after a dose or two, then certainly think about what else it might be. Get help with 911, start doing CPR, things like that. But there's no downside to it. So it's got to be out there. It's got to be available. People need not to hesitate to use it.
And with fentanyl, I think it's important to do at least 2 doses.
Yeah.
Pascal, I'd like to add that Sierra Nevada just got a grant for naloxone. So we're giving it out for free. We'll start probably by the end of the month. So anyone is welcome to come. If you have kids, family members, if you know someone, please come to the hospital and we'll educate you on how to use it when we give it out, and it'll be available hopefully by the end of the month.
More resources, the better. Because I really think that, I mean, when Phoebe contacted me about this town hall, she was talking about the testing strips, and I'm like, testing strips? I had no idea. I had no idea that we actually could, that there were testing strips for fentanyl and that they were available and that you could just, that is an option. So definitely, I'm hoping that we can reach a lot of people today and every day. And I think it probably would be a good idea to repeat the phone number where people can actually just call or text. And Phoebe, do you have that number handy?
Yeah, I mean, the good news is, as you're hopefully gathering from this conversation, there's a lot of access points for resources. Basically, every partner on this call is a place people can go to get naloxone, and many of these places also have fentanyl test strips. But texting might be a good option for people as well. And so both public health and behavioral health have numbers that people can either call or text. And I'll put them in the chat as well. But 530-388-6364 is a good number that people can reach out to. And I'll add some other numbers in the text. And there's a website where we've got a lot of this information as well, and virtually everybody on here. And I do really want to stress that while many of us are access points for treatment, you don't have to be seeking treatment to reach out for either naloxone or test strips. It may be just that you want to stay safe right now, and that's okay. And we would love to dialogue with you, get you what you need, talk to you a little bit about how you can stay safe right now, and open the door for you. So if you reach a point in time when you want to pursue looking at treatment, that's there too. But it's the beginning of a relationship and reaching out.
Yeah, reaching out and also reaching out to your friends, to family, if that's an option. Just and for everybody else, the same thing. Just help share the available resources and try and talk about. Yeah, well, you will not be. Please call. Even if you have naloxone and if you give a first dose, still call 911. It's okay. It's safe. It's safe for you, and it's the right thing to do anyway. But it's also safe that you won't get in trouble. And we have so many. There's so much going on. I mean, there is of course COVID, and there are of course fires, and likely over the weekend, probably large portions of the Sierra will lose power because it's we have a wind event. So there is a lot of stress, and while this is about overdoses, can we talk a little bit about how we can maybe lower our stress levels? And I think that's something that everybody could use anyway. How we can lower maybe our stress levels without the use of fentanyl.
Happy to speak to that a little bit, and obviously others jump in, but I think something we've tried to stress throughout all the challenges we've faced over this past year is just the basic self-care principles. It's time to just reground ourselves in those pieces, do your best to eat healthy foods, get yourself outside when you can, get exercise if you can, try to get good amounts of sleep, and then really connecting with other human beings, your friends, your family, your coworkers, whoever that circle is for you. It's unbelievably helpful to just open up a little bit to somebody and say, I'm actually not having that good of a time right now. This is really hard for me. Just saying that builds a relief in yourself and a connection with somebody else, because good chance if they're not feeling that way right now, they felt that way recently. And through that connecting, it can really take a lot of the angst out of this time for us. And so just trying to find ways to support people in those kind of basic strategies of caring for each other and themselves first and foremost.
Yeah, I agree with that, Phoebe, and I appreciate the question. I think, this has been an extraordinary year in a lot of ways, and it's not just people turning to fentanyl; it's people turning to all kinds of different things. And there's been a lot of gallows humor among colleagues of mine about, don't check my recycling bin for how many bottles of wine are in there lately, because it's really been quite an interesting time. We've been isolated in a way that we haven't been before. I haven't seen my mom since, I don't know when, January, I think, and other people that I'd really like to see. And I think that just takes an enormous toll on people. And I'm fortunate because at least I get to go to work, 5 days a week and go see people there, but we're all wearing masks. It's very difficult to really connect to people in the ways that we used to before. So I think that all of us are taking a hit. It's a psychological hit, and we're all trying to figure it out. We have tried to be a lot more deliberate at the hospital in terms of connecting. And we've had events, where we have events on Zoom, but we've also had some in person with all the social distancing and masks and all that good stuff, in limited numbers. But we are really trying to deliberately find out how people are doing. And so, when you pass somebody in the hallway, this question of, hey, how are you, is taking on a whole new meaning now, because truly people are stressed out. And so many of my colleagues are dealing with, distance learning with their children. Maybe they've got a hybrid situation that's causing all kinds of stress. There's massive financial pressure on families right now. So I don't know, like somebody was saying, I don't know what the long-term effect of all of this is, but I think it does make the issue of substance use disorders much more significant for us. And we've got to figure some of these things out. The other thing I just want to throw out there as more of a question is, we've got the panelists here, we've got the participants here, and these kinds of events are fantastic. And I hope a lot of people watch this on YouTube. But the people that we really need to reach right now, I'm not sure they're here. And I don't know what they're doing right now, whether they're watching the presidential debate or they're doing something else. But, I think about communication quite a bit, and whether we've communicated enough, and to whom, to the right people, and how are we doing that? I think that the county's done a fantastic job in a lot of ways. I know CORE does a tremendous amount. I just don't know if, we have actually done enough to really connect to the people that need to hear about these important messages, and if we need to get more creative, and what else can we do? So I just be open to suggestions along those lines. And it's something I'm concerned about.
And maybe it would be, maybe we have to, could all reach out, be that to the schools or to distance learning, the new center that's opening at the fairgrounds very soon, and actually have, before some classes start, maybe have these phone numbers just as flashcards, or as entry or exit screens, that actually a resource list. If you need food, here is a number. If you if you need to talk to somebody, here's a number. And then the same numbers for both for public health and behavioral health for the as far as substance abuse goes. That might be something we might reach more people. It's one option. We have a couple questions here. If you know someone is addicted to drugs, can you red flag them at pharmacies in Nevada County so the addicted person cannot get fentanyl and other medications like it? Could that help with this issue that we're having right now? And in the ERs, could you ask patients if they really need a strong pain medication? Why don't you tell them there are other ways to deal with pain?
So California does have a cures or PDMH system. So anytime a prescriber prescribes any controlled substance, we're supposed to look at that. So any prescription that is filled anywhere in California should come on there. The only exception to that is if they're going to a methadone clinic, that doesn't come up on the thing. And I'm going to defer to Dr. Evans for the ER question.
Sorry, can you repeat the question? I didn't hear it.
So for the ER portion of the question was, if you have people could come to the ER, do you have to give them the strongest pain medication, or can you suggest alternatives to deal with pain instead of prescribing medication?
Yeah, good question. So we do that. I think that the physicians, first of all, the ER doctors that we have at Sierra Nevada are phenomenal, and we have an incredible supporting team there, and they're very committed to improving the situation that we're dealing with collectively. So they're always trying to sort out, how can we get pain control? How can we get symptom relief in a way that is not going to contribute to an opiate addiction? And it can be difficult. Again, I keep going back to when a million years ago when I was in training, and it was really different back then. And I think we were much more liberal with opiate medication, and it was really all about, let's get the pain absolutely eradicated and get it to zero if we can. And we were not as aware at that time of the significant, effects of opiate overprescribing. I think that we're well aware of it now, and I think the physicians are really taking a lot of care to not contribute to that problem. And there are alternative medications that can be used many times that are more effective than opiate medications for pain relief for a variety of painful conditions.
Anyone wants to add anything to that? Okay. The next question is, again, why are prescription people with prescriptions, why are they lumped in with when there is an overdose that happens, a quote unquote real accidental overdose? Why are those cases lumped in with recreational drug use? And I think that goes a little bit to the stigma question, stigma that some people feel is associated with prescription drugs. Phoebe?
What I would say, and I'll certainly public health folks or others jump in on this, but they're all accidental overdoses. None of the people are planning to die that day, whether they took drugs because they were prescribed or they took drugs for other reasons. And it's still a tragic loss of life that we want to prevent. And that's why we're here today, is to reach all those different people and get some life-saving strategies in their hands.
The data that we have in public health does break it down that we got from the EMS world, that prescription intentional overdose, there's a patient count for that, prescription unintentional overdose, and then there's illicit drug overdose. So we have counts broken down into those three categories from the EMS world.
Of course, not all of that information is necessarily public, so that is why there is a lot of talk about either stigma or then there is the question about why is anybody taking fentanyl as a recreational drug? What is the use of it? Why is fentanyl? Is it because it's readily available? Is it because it's cheap? Is it why? Why is it fentanyl or Percocet or any of these opiates? Can any one of you address that one?
The answer to that question depends. I mean, there's a multitude of different answers depending on, the patient or the person. Some people, start off with opiates in the pill form, go to heroin, and then fentanyl is kind of the next step because, their receptors get used to drugs. And so those opiates, and so they need a higher dose to kind of have euphoria or feel something. And so they may be people who seek it out. Some people it's in other supplies. Some people they've been using opiates for a long time. So there's a multitude of different reasons that I've seen in my patients. I'm sorry, Ariel, I think you were going to say something too.
Only if you didn't. I was going to say I'd defer to Dr. Stevens, but the answer would have been essentially the same.
And I think there's like the question underneath that, which is why are people using drugs? And I think that's obviously the much more complex piece that, we all struggle with. I mean, I eat too much sugar and I try not to. And, and for some people, there's a whole host of reasons that end them up in the boat where they are using drugs, whether it started with a prescription that flipped on a chemical receptor in their brain that made them have a really hard time not using those chemicals anymore, or there's trauma that happened that is painful and needs medicating in some way, shape, or form, or all the different variables that lead to how we all have dependencies on different things in our lives, and trying to undo, again, some of the judgment around that, recognizing the particularly with opiates, the research is incredibly clear how chemically changing it is of your brain, and how critical, how difficult it is to, once you have that chemical piece in place, to just stop using. It's not that simple. And thus there's so much focus on trying to get medication assisted treatments available to people and help make that process a manageable process.
To just add on that, like without medication assisted treatment, 8 to 9 out of 10 people relapse. And so that just speaks to how strong that chemical dependence is.
I have a personal story I'll share about my son. He's 28 and he had an injury at 18. He was a snowboarder and he had surgery and he was prescribed OxyContin. So 10 years later, it ended up with a heroin addiction. So we had 10 really rough years of addiction. He did come in to the hospital and he got on the Suboxone protocol. And I'm happy to say for 7 months, he has been sober. And I got my boy back, which is really awesome. And he feels so good about himself. But had anyone ever told me my son would have been an addict, it's hard it can happen to anyone at any time. It doesn't matter who you are, where you live, what you have, anybody is susceptible to this.
Well, Shelley, I just want to say, sorry to interrupt you. I just want to say that your willingness to talk about that, it's very inspiring. And what you do for patients every day at the hospital is incredible. But to share that personal story, it takes a lot of courage. And I think that's part of what we need to do as a community, is just talk about these occurrences and just take all the stigma right out of it. Because this is a situation, this is a problem that we need to deal with. It's a disease situation. Certainly physicians bear some responsibility, I think, for where we are today with opiates. And so I just commend you for what you do at your job and what you've done for your family.
Oh, thank you. You know, one of the things I tell people when they come in, when I first meet them, is I tell them I'm proud of them. And I've been with men that are just so tough, and you tell them that you're proud of them for making that decision to make a change. And because they don't hear that often, and we need to build them up and not make them feel ashamed. Nobody wants to be in that position, and we need to be there and do whatever we can do to help change that for them.
Absolutely. And thank you for sharing. We have a few people who want to thank you for sharing your story publicly, and absolutely. And kudos to you, kudos to your son, and kudos to the system that actually works. So so you're the example that it actually works. It may take time, but it does work. So there is the proverbial light at the end of the tunnel, which is something that definitely we need to talk about. It is not an automatic death sentence when you are when you have substance abuse issues. There is help, and so we'll just all have to do an even better job at getting the word out and providing for the resources.
Can I just,
Ariel, please go ahead.
add,
Yeah.
Thank you for saying that. And, you know, I think that's a really important message, is there are more than 23 million Americans living in long-term recovery, and it's absolutely not a death sentence. And I think that, you know, seeing here with all these leaders in healthcare, we've had such a system transformation in, I mean, really every year, I would say the last decade, but even before that, really recognizing substance use disorder as a treatable chronic health condition, and taking a step toward doing that's a huge step in addressing the stigma. And so really emphasizing that piece. And there are really strong campaigns to also encourage people to talk about it. And I think that that's happening more and more. And I would also encourage folks, again, on our website, or, you know, go on the web. There are so many, with COVID, there have been a real proliferation of online support groups, peer support groups. So AA and NA are obviously two of the most common and well-known and have helped a lot of people, but there are also a lot of different groups for people who don't resonate with AA and NA. So I just really want to encourage people, like you said, to go out there and connect and talk with other people that are living joyful, productive, healthy lives in long-term recovery. And finding that help in so many different ways. There's not one right path. There's not one right provider. It's really individual support and pathways. And I think everyone here is here to help connect people to those pathways and support that. But thank you for bringing that up, because that's a huge, and ending on, or I don't know if we're ending, but really communicating this message of hope. And that's what we get to see too as providers every day, is welcoming people and saying, we're so glad you're here. You know, how can we support that next step? And you'll be surrounded with a lot of people who are living lives in long-term recovery.
Just a couple of quick comments, and this was brought home to me by a long story that I won't share, but were shared with me today about somebody with an addiction problem. The first step is the biggest step. It's the longest step, and it's the one that a lot of people aren't willing to take. And the thing that's lacking in our society right now, in our culture right now, is trust. Without trust, people are not willing to take that first big step to seek help. There's such a stigma, like we've been talking about. Our society is just so much mistrust now. Nobody knows what to believe, for instance. But it was brought home to me by listening to this story today that almost brought me to tears at my office about an individual. And I actually saw a healthcare provider today for something unrelated to an addiction thing. But you know, it was all about trust, building a relationship, taking that first step, that big giant step. And then key was establishing trust so that you're willing to move forward through some difficult times. I'm sure Shelley's 10 years have not been all great. There's been some very difficult times in that 10 years. And it takes a lot of courage for her as a mom, for her son to come forward and go through that and walk through that together. But that requires trust. It requires a relationship. And so much of our society is lacking and needing and hurting in that area right now. So this is great to see this community come together like this and talk about this. And hopefully this message can get out, like somebody said, to those people. I think Brian said it, to those people who really need it. And hopefully we're reaching out to that group. So thank you.
Absolutely. And I get a couple text messages from people who are listening in, and the three big takeaways for them were like, there are resources available. Law enforcement is a partner to get people into treatment. Law enforcement is not there to arrest people or throw people in jail, but they are first responders, just as the firefighters and the medics. And again, the resources are available, and it's okay to ask for help. So that seemed to be the three big takeaways, and I think that's actually a pretty good summation. So if any one of you would like to add anything to this, otherwise I'll grab all the the resources from the chat, and I will add them to the final version, the video version, so that all the links are and phone numbers will be in there. But if anybody would like to have a closing statement, please.
I just want to say that this year, has taught me a lot about trauma-informed care. I think I see how my patients throughout the years have dealt with so much every single day. And this year, I feel like we as healthcare providers have gone through that, and it's been chronic. And so I think it's been a lesson in empathy, and it's been a lesson in resilience. And I think a lot of the statements made today is important, because one of the biggest principles of resilience is that we need to do it together. We can't do this alone. And so I'm really glad we're having this conversation and this discussion tonight.
Yeah, and I'll just say that this issue, the COVID pandemic and everything, has reinforced an important lesson that I've learned being part of Nevada County for the last 20 years, which is that we're not an island at this hospital. We are part of a community of resources and professionals, and we rely very heavily on all of you. And I hope that you feel the same way towards us. The hospital should be a life raft in some cases for people. We need to take care of folks, take care of our neighbors and friends and family members in some cases, as we've heard, and take care of them with a non-judgmental approach, with kindness and compassion. And I think that's what we need to be doing with this particular issue and all issues. This hospital is yours. It's a community-owned asset. We're here to solve whatever problems come. We're here for whatever medical issues come. And this is certainly one of the hot ones that we really need to step up and take care of. So with all of your help, that's what we're here to do.
Thank you.
I just want to say I put my cell phone number in the chat box. Anyone can call, text, whatever works for them. If they want resources to anything, you can give me a call.
Thank you, Shelley.
Pascal, this is Steve from the from the law enforcement side of things. I think what I would want to convey to the community is that we live in a very special area, in that all the organizations represented here, in this meeting, we work very closely together on a continual basis. And much of that has to do with how to tackle these problems and the problems of substance abuse and how to reach people. And in the law enforcement world, sometimes people are hesitant to reach out for help because of the criminal aspect of substance abuse. But back when I started many years ago, we did not understand, how to deal with substance abuse, and we just called it a crime and threw people in jail. And that was not a very effective way to deal with things. And certainly we've evolved as a society. And there is so much help available now, just within our community. And you know, this town hall is a testament to that. And so if someone is hesitant to reach out for help because of the potential criminal consequences, or they're worried about that, you know, even our criminal justice system is heavily focused on providing help. And even you know, if an individual finds themselves in the criminal justice system after being arrested or something, there are processes and special situations throughout the court process that are focused on getting people help, and not so much a punishment model, but you know, that rehabilitation and getting people help. And so even in the law enforcement world, that's what we're about. You know, the system deals harshly with the worst offenders, and by that I mean people who are providing and peddling the dangerous drugs and synthetic or the fraudulent, you know, narcotics that are laced with fentanyl and that kind of thing, that we're seeing the tragic results of that. That's where the criminal justice system still hammers away on people that would victimize others like that. But if someone is out there looking for help, there's a lot of resources. Even law enforcement would be happy to connect you with resources. And we're not looking to just throw people in jail. So I just want that to be said as well.
Thank you, Steve. Anyone else? Okay, with that, I would like to thank all of you for making time on this for this town hall. I know there is a much larger debate going on live right now that is probably gonna affect, maybe it's gonna affect more people, but this is our community, and so these are the people that can help, that are here to help. So please reach out to them. It's okay to ask for help. Really, it's okay. And if you want to stay anonymous for maybe for the first step, etc., you can contact us, and we will forward your questions anonymously. That's reporters. We know how to keep things off the record. If that's a concern, email us, and we will try and find you the answers. But just know, please, everybody, know that there's help out there, and you too can be safe. So, and with that, again, everybody, thanks so much for spending a part of your evening with us. And this recording will be made available. Of course, it will live for quite a while, I believe, on YouTube. But again, thanks everybody. Thanks to all our panelists, to the attendees. Thank you for your questions, everybody, and be safe out there. Bye.